Hello all. This video will explain to you about the histology of the male reproductive organs. So at the end of the session, you will be able to describe the histological structures of the testis, epidermis, vas deferens, prostate, seminal vesicle and the penis. The male reproductive organs are scrotum. Within its contents are the testis, as you can see here, the epidermis and the lower part of the spermatic cord. Then you have glands, which are the seminal vesicle, highly coiled structure. You have the prostate. There are two seminal vesicles. There is one prostate and there is two bulbourethral glands. These are also called as the Cowper's gland. So there are three glands: seminal vesicle, prostate and bulbourethral gland. Ducts, you have ductus deferens or the vas deferens, as you see here. This is the ductus deferens or the vas deferens, and the ejaculatory duct. And then you also have the penis. All of them contribute to the male reproductive organs. Let us look into the story of how the sperm passes through the male reproductive organs. It is produced in the testis. It gets matured in the epidermis and gets stored here. Then it travels through the vas deferens or the ductus deferens. It comes to the posterior aspect of the urinary bladder and enters into the ampulla of the vas, its dilated area, which is medial to the seminal vesicle. Further, the sperm fluid will mix with the fluid coming from the seminal vesicle. It enters into the ejaculatory duct. So ejaculatory duct is formed by the joining of the ampulla of the vas and seminal vesicle. Then the fluid passes through the ejaculatory duct. Also the ejaculatory duct are two in number, left and right. Okay, this we are seeing is the sagittal section. It empties the fluid, then empties into the, carrying the sperm, empties into the prostatic urethra. From the prostatic urethra it goes into the very narrow area which is called as the membranous urethra over here. And at the same, this is the same site location for the bulbourethral gland. Bulbourethral gland is situated in the membranous urethra. Then it passes through the penile urethra and it comes out as ejaculation. Okay, and also remember, physiologically the ejaculation occurs at a separate time when related to the maturation. So that was the story of how the sperm passes through the male reproductive organs. Now coming to the histology of the testis. The testis is divided by septae into lobules. So you can see the section of the testis over here, and you can see that this is a septum over here. So if you will draw the line through this is called as the septum. Okay, the septum divides the testis into different lobules. Okay, so these are the lobule. This is a lobule and this is the septum separating the lobules, and each lobule contains seminiferous tubule. So what you're seeing here, the coiled structure, this is called as the seminiferous tubule. There is 1 to 4 seminiferous tubules, and there is interstitial tissue, which you will be seeing in the upcoming slides. So you can see that the seminiferous tubules then go towards the mediastinum testis. Mediastinum testis is also called as the rete testis, and further the rete testis enters into the efferent ductule, and then this part is called as the head of the epidermis. This part is the head of the epidermis. Then the body of the epidermis. This is the body of the epidermis, and then further you have the tail of the epidermis. Then you have the beginning of the vas deferens. This is how the sperm passes through the testis and then the epidermis. So moving on, you can see that the seminiferous tubule, section of the seminiferous tubule, each seminiferous tubule is lined by stratified epithelium. Okay, there are two types of cells. Which are the spermatogenic cells and the Sertoli, which is the supporting cells. The spermatogenic cells are spermatogonium. So here in this section you can see that this is a section of the seminiferous tubule, and towards the base over here is the spermatogonium cells. Okay, so towards the base is the spermatogonium cells. Then the next will be the primary spermatocyte. This is the primary spermatocyte, which is very large in size when compared to the all the other cells over here. Then you have the secondary spermatocyte. So you have to go in order. From the base you have to go towards the lumen. Then you have spermatid, and then towards the lumen you can see the tail of the sperm. All these are the tail of the sperm towards the lumen. So there are sperms which are also called as spermatocytes. Now you can also see another group of cells which are called as the Sertoli cells. So they are nothing but supporting cells. The shape is elongated pyramidal cells. They help in support, they protect, they nourish the spermatogenic cells. They also phagocytose the cytoplasmic remnants of the spermatids. Then they secrete androgen binding protein ABP, hormones, and they establish the immunological blood-testis barrier. Okay, so the Sertoli cells are very important, and they are the supporting cells helping to nourish the sperms over here. Moving on, you can again see the spermatogenic cells, the arrangement. So here this is the base, this is the basal lamina, means the basement membrane over here. So here this is the spermatogonia. These are small cells about 12 micrometer in diameter, very close to the basal lamina. Next you have primary spermatocyte. This is a primary spermatocyte. They are the largest cell of the spermatogenic layer, and they are characterized by coiling of the chromosomes. So you can see chromosomes are started to coil here. Then you have secondary spermatocyte, and their size is smaller than the primary spermatocyte. Then the spermatids. Okay, the spermatids, they are the small cells about 7 to 8 micrometer with the nuclei showing areas of condensed chromatin. They undergo spermiogenesis. So the process of formation of the sperm is called spermiogenesis, in which the spermatids get converted to sperms. Okay, then you can see the structure of the sperm. The sperm consists of the head, which is about 5 micrometer. It is formed of the nucleus of the condensed chromatin, and it's covered with acrosome. Then you have the middle piece, which is about 5 micrometer. It is rich in mitochondria. It gives energy for the swimming. And the principal segment are called as the tail, which is about 50 micrometer. Now, the interstitial tissue contains the cells of the Leydig. So remember the contents of the testis. We said the section contains the spermatogenic cells and the interstitial tissue. So present in between the seminiferous tubules and consists of connective tissue, nerves, blood, and lymph vessels. So you can see that this is the interstitial tissue, and here it is a part of the seminiferous tubule which you are seeing here. You can see another seminiferous tubule over here. These cells situated inside are called as the Leydig cells. So they are round or polygonal in shape. The shape is round or polygonal with a central nucleus and eosinophilic cytoplasm. They secrete testosterone, so it's very important function. Which cells secrete testosterone hormone? They are the Leydig cells, and it's responsible for the secondary male sexual characteristics. You can also see the other cells. So this is the smooth muscle covering the seminiferous tubule, and from the base, if you start, this is the spermatogonic cells, then you have the primary spermatocyte, which is large, then the secondary, okay, the secondary over here, then you have spermatid, okay, then towards the lumen we should look for the sperm, okay. Then there's another section in which you can see a good overview of the testis. There is a small piece of the epidermis also present here. A part of the epidermis is here. You can see the covering of the testis is called as tunica albuginea, which is white in color. Then you have an outer covering which is called tunica vaginalis. Tunica vaginalis has 2 layers. We'll see about the details in the next slide. The testis is divided into different lobes by the septum, and towards the mediastinum it's called as rete testis. Then we saw the continuation towards the epidermis, head of the epidermis, through the efferent ductule, okay. Now the tunica vaginalis has 2 layers. These are called as the parietal layer, which lines the scrotal sac, and the visceral layer, which is close to the tunica albuginea. In this diagram you can see tunica vaginalis having the parietal layer, which is lining the scrotal sac, and then you have visceral layer very close to the tunica albuginea, and between them is called as a cavity of the tunica vaginalis. There is some amount of fluid being secreted over here normally. Now we can learn a clinical anatomy feature over here. So if the cavity of the tunica vaginalis is increased because of collection of fluid, increased fluid collection between the 2 layers of the tunica vaginalis, this condition is called as hydrocele. And this is how it looks like. So you have the testis here, the epidermis, and you can see the collection of fluid over here, and the name of this is called hydrocele. So where is the location of this collection of fluid between the 2 layers of tunica vaginalis? Okay, then moving on, you can also see the seminiferous tubules. Okay, so there is, like we already saw, that about 2 to 4 in each lobe, and you can see the interstitial tissue over here. And remember, the seminiferous tubules have 2 sets of cells. One is the spermatogenic cells, and the others are the Sertoli cells. Sertoli cells. So here again we can see the smooth muscle, which is covering the seminiferous tubule, spermatogonia. Then you have the primary spermatocyte, okay, then the secondary spermatocyte. Then these are the spermatids. You can see they are in the maturation phase over here. Okay, so these are the Sertoli cells. Sertoli cells, large cells, are the primary spermatocyte. Next organ we'll be looking is the epidermis. So the head of the epidermis, it contains the efferent ductule, which connects it to the testis. Now the body and tail of the epidermis is formed of a single narrow duct, and it is very highly coiled. The duct is lined with pseudo-stratified columnar epithelium. It is made up of 2 cells. One is the tall columnar cells, which are called as principal cells, and then you have short absorptive cells called as the basal cells. So there are 2 types of cells. Let's see. These are the tall ciliated cells, okay, tall columnar cells, and then you have the short cells. These short cells, other than the tall cells, you can see short cells, okay. So these short cells are called as short absorptive cells, which are called as basal cells. They are close to the base. They are close to the base. Now, so these columnar cells, they have long branched microvilli, which is called stereocilia. Okay, so we can say the epithelium of the epidermis is pseudostratified columnar epithelium with stereocilia. Okay, with stereocilia. So they have microvilli over here. Now, the epidermis will show presence of ductus epidermis lined by pseudostratified columnar epithelium with stereocilia. So we can see again the 2 sets of cells, the principal cells, that is the columnar cells, the basal cells, which are close to the base, the short cells. Then you can see the stereocilia. Okay, so this is the stereocilia. you will see thickening of the smooth muscle fibers. So it's now more thick. You can see that it's dark pink here. And usually we can also see sperm within the lumen of the epidermis. What is the function of this epidermis? Helps in the sperm storage in the tail of the epidermis. It helps in the maturation of the spermatozoa, and it makes it motile. Okay, so till then it is immotile, okay, not moving. Whereas after it gets matured, after the spermatozoa gets matured, it becomes motile, that is, it starts becoming a mobile structure. And then absorption of the 90% of testicular fluid by the stereocilia. So this is the function of stereocilia. So what is a stereocilia? Why is it present in the epidermis? It helps in absorption of the 90% of the fluid which is coming from the testis. Okay, so it basically concentrates it, it matures the sperm. So next, vas deferens, it is also called as ductus deferens. It has a very thick wall and a very narrow irregular lumen. The wall is made up of 3 layers. So you have mucosa, then the musculosa, okay, which is with the muscle layer, and then the adventitia. So mucosa is formed of short folds and is lined by pseudo-stratified columnar epithelium with long stereocilia. The lamina propria is rich with elastic fibers. Musculosa, it is 3 layers. It is well developed. It consists of thick middle circular layer of the smooth muscle between the thin inner and outer longitudinal layers. So you have inner longitudinal, middle circular, and outer longitudinal layers. We'll see in the next slide. And there is only adventitia. There is no serosa. That means adventitia means that it is dense connective tissue without any peritoneal covering. Okay. So we can see the lumen over here. Okay, it is very narrow, and you can see very this is the mucosa. Okay, the mucosa over here, and you should know the lining of the mucosa. We said it is pseudo-stratified columnar epithelium. Next, you can see the muscle layer. So this is the muscle layer. The muscle layer consists of inner longitudinal, middle circular, and outer longitudinal layer. The outermost will be the adventitia. Okay, and here, like if you would take a section like this, so let's say you're seeing this area over here. Okay, so this is the area which is shown in this diagram. So you can see the lumen. This, the white color means the lumen over here, and then you can notice the epithelium. So we said that there is it is pseudo-stratified columnar. That means there are 2 types of cells, the principal cells like the columnar cells, and then you can see the basal cells. Okay, these are the basal cells. It is pseudo-stratified columnar epithelium with stereocilia. Okay. Okay, now moving on to the very, very important gland, which is the prostate. So the prostate consists of alkaline fluid, or secretes alkaline fluid, also the fibrolysin, and prostate specific antigen. It's called PSA, directly into the lumen of the urethra. The prostate is covered by a fibromuscular capsule. Okay, so there is something called as a true capsule and false capsule. Then like you see here, inside the prostate you have the urethra running. This is the prostatic urethra. Okay, so if you see a section within the prostatic urethra, then it will be lined by transitional epithelium. It will be lined by transitional epithelium, like the continuation from the urinary system. Okay, so you know the urinary bladder also has the same transitional epithelium. Okay, so this part which you're seeing here, this is the prostatic urethra. This is the prostatic urethra. So if it is asked like this is lined by which epithelium, you should answer that it is the transitional epithelium which lines the prostatic urethra. Okay, now also you can see that there are a lot of glands. What you're seeing here, these are glands. These are called as tubulo-alveolar glands. Okay, so you can see the section is shown here, tubulo-alveolar glands. So the white area which you're seeing, that is actually the lumen of the gland, and these are the glands. Okay, so it gives like a kind of a flowery kind of appearance between the glands. So if you see, this is one set of glands over here, right? and then there's another set over here. So between the glands you have the pink color structure, which is called as the fibromuscular stroma. Okay, so it's again important. So the fibromuscular stroma separates the tubuloalveolar glands. Okay, fibromuscular stroma is separating the tubuloalveolar glands. Okay, so already we have seen the type of fluid. It is alkaline fluid. It secretes white alkaline fluid. It adds to about 30 to 50% of the seminal fluid. Okay, if you see the size, it is about 3 centimeters in length and width, and maybe 5 centimeters in height. Okay, so the weight is about 11 grams. Okay, so it is large and dense exocrine gland. Okay, now what does a prostate gland consist of? It has a prostatic urethra, which is lined with transitional epithelium. It is not shown in this slide. Then the fibromuscular stroma that you see here, this in pink, this is the fibromuscular stroma. It separates the different glands, and you have many tubuloalveolar glands. So these glands which you're seeing here, are the tubuloalveolar glands. Okay, so these are the tubuloalveolar glands, yeah, shown here. So it has a kind of a flowery kind of appearance. So the tubuloalveolar glands separated by fibromuscular stroma. So this is the normal prostate which you are seeing here. Now in pathology sections, they may talk about increase in the fibromuscular stroma. So there is thickness of the fibromuscular stroma. Then the tubuloalveolar glands, they get narrowed. Or there's increase on number of tubuloalveolar glands. So you can notice all these changes. So identify the normal anatomy and normal anatomical or histological section. So then you will be able to appreciate the abnormal. So the tubuloalveolar glands are lined by simple columnar epithelium. Okay. Now the name of these glands, okay, according to the position, it is called as mucosal glands, submucosal glands, and the main glands. Okay, in upcoming slide I will show you the location of this. Okay, so the name of the glands are mucosal, then submucosal, then main glands. Okay, in this diagram you can see like a circular pattern over here. These secretions are called as corpora amylasia. Corpora amylasia, it is called as prostatic concretions, which is present within the prostate. Okay, so this is something very typical feature for the prostate. It's called as corpora amylasia. Again, you can see that increases in benign hypertrophy of the prostate. You will again learn about it, but also it is normally present in older male. Okay, so this is called as corpora amylasia. These are prostatic concretions. Now anatomically, we divide the prostate into 5 lobes. So the names of these lobes are anterior lobe, posterior lobe, median lobe, and 2 lateral lobes. This division is based on the passage of the prostatic urethra and the ejaculatory duct. So the section which you are seeing here is a sagittal section. In the sagittal section, you can see that this is the prostatic urethra which is running here. Okay. Okay, this is the prostatic urethra running. Now this prostatic urethra is dividing it into, in front of it, it's called as the anterior lobe. This is the anterior lobe. Now you can see another duct here. Sorry. So another duct which is passing. Which is called as the ejaculatory duct, right? This is the ejaculatory duct. Now, if you see a lobe between the prostatic urethra and the ejaculatory duct, it is called as the median lobe. Median lobe. Now, behind the ejaculatory duct is called as a posterior lobe. So there are 3 lobes which you can see in this view. anterior lobe between the anterior part of the prostate and the prostatic urethra, the median lobe between the prostatic urethra and the ejaculatory duct, and the posterior lobe behind the ejaculatory duct. Now, how can we look for the two lateral lobes? So we need to go to a coronal section. Okay, so when you cut the body into dividing the body into an anterior and a posterior half, this is called as a coronal section. So in coronal section, we can see the two lateral lobes. This is the two lateral lobes, and what is passing in between, this is the prostatic urethra. Okay, it's called as the wool of the urinary bladder, which you're seeing here. Okay, prostatic utricle, all these structures you can see at this point over here. Fine. Now we can concentrate on the lobes. So there are totally 5 lobes, which are the anatomical divisions. When we go to histology or pathology, they have a different classification. Okay, so the name of that classification is into three zones of the prostate. The name of the zones are peripheral zone, PZ, then central zones, CZ, and transitional zone or periurethral zone. Okay, so let's identify this diagram. It's a 3D structure. What you're seeing here, this is the seminal vesicle, and this is the ample of the vas. So these are the ejaculatory duct. You can see the 2 ejaculatory duct over here. Let me use the pointer. Okay, so this is the ejaculatory duct. You can see the 2 ejaculatory duct over here, right? So now this part, this side is the anterior, and this is the posterior. This towards this part is the posterior. So the green, what you see in green, is the peripheral zone. This is the peripheral zone. The one behind is the peripheral zone. Then we can see that around the ejaculatory duct, okay, this part, it's blue in color, cyan blue in color. So this is the central zone. This is the central zone. So you can see it's extending from the around the ejaculatory ducts towards the prostatic urethra. So this is the area, and that is the central zone. Now around the prostatic urethra and towards the anterior aspect, okay, that is called as the transitional zone or the periurethral zone. So according to the name, periurethral, so it's around the urethra, Now, so pathologically we have 3 zones. The large one is called as the peripheral zone. According to the name, it is in the periphery, so the posterior most. Then in the center is the central zone, so it is in between the ejaculatory duct and the prostatic urethra. Surrounding the prostatic urethra, coming anteriorly, is the transitional zone. So this is a 3D view of the prostate around the prostatic urethra. There is one more area, okay, it's called as a fibromuscular zone. Okay, so it's not very important, but anyway, here that's most anterior. Okay, that's a fibromuscular zone. So the 3 important zones of the pathological division are the peripheral zone, the central zone, and the transitional zone. So let's see the importance of knowing the these zones. Okay, I had mentioned to you previously about mucosal glands. Okay, so let's look into this diagram. Here, this is the prostate, and you can see prostatic urethra passing in between. The urethra is here, and just around the urethra, these glands, the one in pink, these are called as mucosal glands. Just around the mucosal glands are the submucosal glands, the one in orange color. Okay, and the outermost is called as main prostatic glands. So the glands are based on their location. They are divided into 3. It's called mucosal glands, very close to the prostatic urethra. Then around it is called as the submucosal, below the mucosa, and then outermost is called as the main prostatic glands. Okay, so what is the importance of knowing these? Clinically, the benign hypertrophy of the prostate. Benign means it's not cancerous. Okay, so it's like slow growing. Okay, it begins in the 50% of the male. It is seen in the 50% of the male after the 50 years of age. This hypertrophy occurs in the mucosal and submucosal glands. In the mucosal and the submucosal glands. Okay, so in this area, it affects the. Now you have to we have to correlate with the zones. It affects the central zone, okay, and the transitional or the periurethral zone. So around the periurethral zone, and it is around the central or the transitional zone. Okay, so the benign hypertrophy of the prostate affects the mucosal, submucosal glands, and it affects the central and the transitional zone. Now, the in comparison to benign, we go for the carcinoma of the prostate. The carcinoma of the prostate, which is the malignant hypertrophy, it affects the main glands of the prostate, which is present in the periphery, right? It is affecting the main glands of the prostate, and it affects the peripheral zone. It affects the peripheral zone. So if you would like to compare the symptoms for the two cases, in benign hypertrophy of the prostate, you will find symptoms related to constriction of the prostatic urethra. Okay, so he will have in difficulty in maturation, initiation of maturation, and so on. Okay, whereas in main gland, when the carcinoma of the prostate, as it starts at the peripheral zone, the symptoms may be quite late and may appear late. They may be pain, okay, maybe burning maturation, and once it like proceeds, okay, in the starting it is at the peripheral zone, and then slowly it comes towards the if it comes towards the central zone or the periurethral zone, then it will start causing the difficulty in maturation. Okay, so that is one of the difference in the symptoms of the carcinoma of the prostate when compared to the benign hypertrophy of the prostate. Okay, moving on with to seminal vesicle. So these are paired seminal vesicles which secrete about viscous fluid. It constitutes about 70% of the ejaculate. The paired seminal vesicles are highly coiled tubular structures about 15 centimeters in length. Seminal vesicle mucosa is highly convoluted, and the lumen is lined with pseudostratified columnar epithelium. It's composed of the same short basal cells and the low columnar cells. So here you can see this is the lumen. Okay, you can see it's filled with the secretion. Here this epithelium is the pseudostratified columnar epithelium. You can see the basal cells over here, very short cells. Okay, so here this is a section of the seminal vesicle. It's a very highly coiled structure. This is the lumen. Okay, and this is another view in which you can see the epithelium over here and the lumen over here. The last organ with the penis. So you have two of the columns of erectile tissue, which is called corpora cavernosum. Okay, it is present dorsally, that is seen here in this diagram. This is the corpus cavernosum, and the third tissue, which is third column of erectile tissue, is called corpus spongiosum. So there are three tissues. You have the two corpora cavernosa and one corpus spongiosum, which is present ventrally. The corpus spongiosum ends distally in an enlarged bulbous portion, the glans penis, which is called as the head of the penis. The tip of the glans penis is pierced by the end of the urethra as a vertical slit. So you can see the vertical slit of the urethra is present in the corpus spongiosum. You will not see it in corpus cavernosum. Okay, and you can also see the outer covering of corpus cavernosum, which is tunica albuginea. Then also you can notice some blood vessels over here. This is the superficial dorsal vein and the deep dorsal artery and the vein over here. You can notice the cross section of the penis, in which the vessels are seen here, whereas the corpus cavernosum of the penis is here, the two erectile tissue, and this is the corpus spongiosum with the urethra, the penile urethra slit opening over here. Same with the histological section, you can see that this is the corpus cavernosum and this is the corpus spongiosum with the penile urethra. Okay, so by this we come to the end of the histology of the male reproductive organs. I hope you had a good learning experience. Okay, so next time when you look for a section of the kiwi fruit, also remember about the section of the testis. Okay, it looks similar. Okay, thank you all.